doing an oral care or mouth care. Hygiene is a science and art which is associated with the prevention and promotion of health. Good personal hygiene is important to a person's general health. Personal health implies to those principles of physical cleanliness and mental health, which are practiced by a person at individual level. Personal health includes body, bathing and washing, care of hair and feet, mouth cleanliness and care of teeth, care of the nose and ears, clothing, postures, exercise, recreation, rest and relaxation, sleep habits, and nutrition. Personal hygiene is maintained for a person's comfort and well-being. A variety of personal and socio-cultural factors influence the client's hygiene practices. For mouth care, it is defined as a scientific care of teeth and mouth by using antiseptic solution. This is to keep the mucosa clean, soft, moist, and intact. To keep the lips clean, soft, moist, and intact. To prevent oral infections. To remove the food debris as well as a dental plaque without damaging the gums. And to alleviate pain, discomfort, and enhance oral intake with appetite. Before we start the procedure, we need to explain the procedure to the patient. This is to reduce the unease and to get the cooperation with the patient. Next, we need to wash our hands. This is to reduce the transmission of the microorganisms. Gather all the equipment near the patient's sides to promote efficiency. Discuss the procedure to the patient to discover hygiene preference. Wear a clean gloves if needed. This is to prevent contact with microorganisms or body fluids. We need also to assess oral mucosa, teeth, and throat. This is to determine the status of the oral cavity and the patient's need for care and teaching. First, we need to take the patients at the edge of the bed and if possible in a semi-fuller if it is not contraindicated. So, we need to help a patient in the edge of the bed in a semi-fuller position. This is for us to have no difficulty in doing the procedure and to prevent the aspiration. Next, we need to put a small Macintosh with a face towel on the patient's chest and tuck it under the chin. This is to prevent the soil and make the patients comfortable. Next, we need to place a kidney tray against the cheek and directly under the mouth. This is to dispose the used gauge. So, assuming this is our disposable or our kidney tray. We need to place it underneath the patient's mouth. Okay. So, if you have an automatic bed, you can raise the head end of the bed to 45 degrees. This is to avoid the aspiration. However, if the patient is unconscious, we need to take note, unconscious. With the help of tongue depressor, gently open the jaw. This is to prevent from the injury and bleeding. Examine the patient's oral cavity completely with the help of the torch, tongue depressor or spatula, and a gauge to identify any changes in moistures, cleanliness, infection or bleeding, ulcers in the oral cavity. Next, we need to pour an antiseptic gauge into the cup, a soak of gauge in solution, and squeeze with the help of the artery forceps. This is to prevent the infection and easy to do the procedure. In the teeth, from the incisors to the molars, up and down movement from the gums to the crown. This is to promote the circulation and proper cleanliness. Use one clamp to pick up the gauge and the others to clean. This is to avoid cross-contamination. Clean the oral cavity from proximal to distal using the gauge from each stroke with wet gauge. This is to avoid also cross-contamination. For supportive and oriented patient, toothbrush might be used to clean the teeth. This facilitates the patient to involve with self-care. Next, discard all used gauge into the basin. This is to help for proper disposal to make the patient comfortable. Provide a tumbler with the water and instruct the patient to gargle the mouth. This is rinsing. Rinsing take away loosened debris and make the mouth taste and freshen. During rinsing, we need to position the basin properly. This is to prevent from the spoilage to the other area. And then we need to clean the tongue from the inner to the outer, folding a rag piece such as away to the teeth. This is to prevent injury and to remove the bad taste in the mouth. Next, we need to provide water to rinse the mouth because rinsing removes the debris and make the mouth taste fresher. Next, we can lubricate the lips using the swab stick. This is to prevent dry lips and lips crack. Wipe the face with towel to prevent the patient from uncomfortable and promote the positive body image. Rinse used articles and replace equipment to prevent the safe and comfortable environment to the patient.